My animal health management video is about equine laminitis. In this video I will discuss what laminitis is, the clinical signs, the causes and the management of this painful disease. Laminitis is a common, extremely painful and frequently recurring condition in horses, ponies and donkeys. Equine laminitis affects the sensitive tissue of the hoof and is an extremely painful and debilitating condition. Laminitis is the damage and inflammation of the tissue called the laminae between the hoof and the underlying coffin bone. It can affect all 4 feet, but is most common in the front feet. To understand laminitis, it is important to know about the anatomy of the hoof. Horses bear the majority of their weight on their coffin bone. The coffin bone sits within the hoof capsule, covered in a soft tissue called the corum. The corum is responsible for providing nutrition to the hoof. The coffin bone is anchored to the inside of the hoof wall by the interlocking of the dermal and epidermal lamella. The lamina provides support to the coffin bone as it is 2 folded layers of tissue. When separation occurs, the coffin bone rotates downward. As the coffin bone rotates, it presses into the sole of the hoof. In severe cases, this causes rotation or sinking of the pedal bone through the sole of the foot. We can see in the picture here the inside of the hoof showing the sensitive and inflamed laminae. There are 2 different types of laminitis, rotating and sinking laminitis. Rotating laminitis is when the coffin bone and the hoof wall separate and the coffin bone rotates within the foot. Rotating is the most common type of hoof wall movement and is easier to manage in most cases. However, sinking laminitis is when the coffin bone and hoof wall separate and the coffin bone sinks downward. It is often more life-threatening than rotating. It is also possible for the coffin bone to penetrate the sole of the hoof. We can see from the 2 diagrams the process of both rotation and sinking during laminitis. There are 4 stages to the progression of laminitis. This diagram explains the phases of progression. It begins in the developmental phase and progresses to the subacute and chronic phases. It shows when there is a change in the coffin bone and how it will affect the horse. Horses with acute laminitis will have hooves that appear to be clinically normal. Inflammation is not visible from the exterior of the hoof. The horse may present mild lameness to a near refusal to bear weight. Lameness tends to be more severe when turning or walking on hard surfaces. Horses with laminitis tend to adopt a characteristic stance to take weight off their toes. The forelimbs extend and their hind limbs tuck under their belly. The horse in the picture here is displaying the characteristic stance which they adopt while having laminitis. It is also known as sawhorse stance. Horses with acute laminitis often resist lifting a foot as they are reluctant to place more weight on another foot. They may also have a bounding digital pulse that can be felt on the back of their fetlock, and like I said above, their hooves may be hot to touch. Horses may be distressed, sweating, hyperventilating, and have an elevated heart rate with acute laminitis. Horses living with chronic laminitis will always be at risk of an acute and chronic episode where the laminar inflammation occurs. These episodes frequently lead to subsolar abscessation, which involves hoof abscesses under the sole. These horses are often predisposed to white line disease and to the development of hoof abscesses. In the image we can see a hoof abscess in the bottom right corner of the hoof. In this slide we can see a closer view of a hoof abscess. Clinical signs of laminitis include difficulty walking, especially when turning sharply or walking on hard surfaces, lameness, which is more commonly in the front 2 feet. Affected horses may be hesitant to move, shifting weight between feet when resting. The hooves feel hot to touch. If all 4 feet are affected, a horse may lie down to relieve the pain. Sweating due to the pain and stress. If a horse is not showing laminitic signs, radiographs can reveal rotation of the coffin bone. Laminitis is diagnosed based on a horse's clinical signs, history, and a thorough physical exam. A vet will have a high suspicion of laminitis in a horse with consistent painful response to hoof testers over the toe. This is especially when they show signs of pain in each hoof. Radiographs are a very valuable tool in evaluating laminitis. Vets also look for new separations or rotation of the coffin bone compared to the dorsal hoof wall in acute cases. They would look for bony changes in the coffin bone that would indicate a chronic history of laminitis. The image here shows an X-ray taken of a horse's foot with and without laminitis. In this slide we're going to talk about the causes of laminitis. Laminitis is caused by overeating and feeding. Obesity is also a significant and important risk factor for developing laminitis. The incidence of laminitis increases with excessive or sudden carbohydrate intake. It occurs when a horse consumes lush pastures with high sugar content or when a horse is fed excess of grain. This is typically during the spring months after recent rain. When grass and carbs are ingested, they cause metabolic changes that result in altered blood flow to the laminae of the foot. Working on hard surfaces also causes laminitis, and this is commonly known as road flounder. The risk groups associated with laminitis include overweight horses and ponies, which are extremely susceptible to laminitis, especially when fed rich, lush forages. Geldings are also more prone than mares, and laminitis is more common in adult horses than younger horses. Horses with equine metabolic syndrome and equine Cushing syndrome are predisposed to laminitis. In this slide, I will discuss the management of laminitis. If laminitis has developed by overfeeding, the food source must be removed. Anti-inflammatories such as bute should be administered to the horse. Affected horses need to be on a strict stall rest with deep shavings. Hoof care is vital with laminitis. The farrier should consult with the vet and trim the hoof according to the degree of rotation. An appropriate feeding regime should be put in place. Caution should be taken when allowing a laminitic horse to access pastures, especially during high-risk times such as spring and when there is a high sugar content. Shoeing changes should be implemented with chronic laminitis. Vets and farriers should recommend providing heel and frog support using pads and pour-ins. This will reduce the stresses on the laminae and minimize stretching of the white line. In the picture here we can see the examples of the pour-ins and the uses of pads. The prognosis of laminitis is dependent on each horse and the severity of the disease. Laminitis is an unpredictable condition that is frustrating to treat and manage. It can be very hard for a vet to provide a definite prognosis as the progression of laminitis varies between each horse. The horse will have a better prognosis if treatment is initiated quickly and if treatment is implemented before laminar damage has occurred. A poor prognosis will occur if a horse does not respond to treatment quickly. When rotating and sinking of the coffin bone occurs, the prognosis is often grave. The best way to deal with laminitis is preventing the causes under your control. These include maintaining the horse at a healthy weight, as obesity is a major factor in laminitis, creating a bare paddock and feeding low-sugar forages such as hay or haylage. A grazing muzzle allows the horse to be turned out as normal but limits their grass consumption. Hard feeds and grain should be fed in smaller quantities more often rather than one big feed. A horse's feet should be trimmed correctly, the toe shortened and the heel lowered to ensure the hoof is perfectly aligned with the pedal bone. It is also a good idea to soak hay to reduce the carb content. I have had to do this in the past for my horse that suffered with laminitis and it benefited them greatly. In this last slide, the flowchart shows the different routes and prognosis of laminitis. It starts with acute laminitis and displays the different outcomes of the disease. It expresses how important the first 48 hours are for treating laminitis. It shows that if the laminitis isn't treated quickly and effectively, the horse will suffer in great pain and the outcome will sadly end in euthanasia. Thank you for listening to my presentation.